Hello, my name is Dr. Xiong. I'm one of the internal medicine physicians from Dallas, Texas. In this series of video, I want to talk about a few very common symptoms that I see from my patients, but also sometimes it can be difficult to make a precise diagnosis, and also sometimes it's difficult to treat. Today, we're going to talk about back pain. I'm sure everybody has had some sort of back pain in your lifetime, right? And we see this all the time. So what do we do with back pain? And when do we think the back pain can be an emergency? So I can tell you majority of the times back pain is caused by musculoskeletal problems and can be treated conservatively. Most of the people do get better with or without treatment. So in most situations, with back pain is you probably pull the muscle, or if you have degenerative disc diseases, or if you may have had some trauma, or you bent it in the wrong way, or when you did some heavy lifting that you didn't really use the very ergonomic posture, you may have hurt your back. So most of the time that's the cause of the back pain. And majority of the time what we can do is basic stuff like ice packs, hot packs, pain patches, stretching, physical therapy, muscle relaxer, pain medication. Sometimes we use a little bit of a touch of steroid. With time, majority of the people will get better. However, in certain situations, the back pain persists. Those are the situations we have to worry about, like such as nerve compressions. Sometimes, even with nerve compression, most of the time conservative measures will take care of the problem. Sometimes we may need spinal injections to help with this kind of situation. And rarely, patient may require surgery to correct those things. But I also kind of want to talk about in what situation do you have to probably seek medical attention or go to the emergency room right away. So those are the things that we are worried about, spinal cord compression. So what happens when your spinal cord gets compressed is sometimes we call it either coldness medullary syndrome or caudate equina syndrome. To be honest, those names doesn't really matter. What matters the most is you have to know some of those symptoms that that kind of can give you a red flag to see a medical professional right away. So those are the symptoms are like things like loss of continence, whether it's urine or bowel. That's something that's definitely concerning. If you have developed numbness or tingling sensations around your groin area or around your perineum area, that's definitely not a good sign. Obviously, if you have developed muscle weakness, paralysis, or even like foot drops, those kind of weaknesses on your muscle or your legs are just not, people feel like, oh, my leg I feel like I can't control my legs anymore. So that's also like very concerning. So in those situations, you have to go to the ER and seek medical attention right away. And most of the time, the ER doctor will do emergency, either a CT scan or an MRI to figure out exactly what's going on. And I have seen people that got rushed to the operating room to get their compression of the spinal cord released, and they get better. So this is it for back pain. If you have any questions, please put in the comment section. Please click like and subscribe. If you have any other medical questions or medical terminologies you would like me to explain, please also give me a comment, and I'll try to explain it to you.